It's Dr. Rick, back again with another update regarding the COVID-19 vaccination programme in our local area of Tameside and Glossop. So currently we're in a state of a little bit of confusion, and that's reflected in the number of phone calls that hospitals, consultants and GPs are receiving from patients a little bit confused about what is actually happening. And it's not at all surprising, because we've reached a point when a very, very large cohort of people are currently being called up to have their first jabs. And at the same time, we're starting to prepare for the second jabs, which are now due. So far, everybody in Tameside and Glossop in cohorts 1 to 4, so that's the people in care homes, people above age 70 and people with extreme clinical vulnerability, have actually been called up, and the vast majority have had their jabs. Now we're into cohort number 5 and number 6, and the government has decided we're going to do both these cohorts together. So let's try and make it really simple, because it is quite confusing. So cohort number 5, if you live in Tameside and Glossop and you are aged between 65 and 69, you are going to receive or already have received a letter from the government saying you are now ready for your jab. And they're encouraging people to go to the big national centres. Our local is the Etihad Stadium in Manchester. And I would definitely take them up on that offer, because the wait time to get your jab is really quite low. And then we're into cohort number 6. And this is mainly the responsibility of local services, so our local jabbers and your GP surgeries. And this is a mixed bag of people, so everybody aged 60 to 64 and people with long-term conditions, for example, heart disease, vascular problems, people with diabetes, chest problems, people with liver and kidney problems, and people who have had transplants, and also people who are markedly overweight. And this group is being called up because we've discovered that people with these conditions are at more higher risk of getting nasty COVID infections. Now, because there are an awful lot of people in Tameside and Glossop with these conditions, we are definitely not going to get the right supply of vaccines to get everyone done in the same week. So it's going to have to be staged. And I think this is where it's causing the confusion, because everyone's eager to get their jab, but of course we can't do everybody at exactly the same time. Please be reassured that as soon as vaccines arrive in our local area, our vaccination sites use them within a couple of days. We're really quick off the mark. There's no faffing about in Tameside and Glossop. We're getting really good at this. So our request today is that please be patient if you're in cohort number 6, everybody aged 60 to 64 or people with a long-term medical condition. We will get round to you. And please don't feel aggrieved if somebody else you know has had a jab before you, because people don't know each other's medical conditions, and sometimes they're kept secret, and a lot of the time there are very good reasons why people are in the queue in front of you.